attention deficiency hyperactive disorder, or in short we say ADHD. It is one of the most common neurodevelopmental disorders found in children. So it is usually first diagnosed in children, and then it often lasts in adulthood if it not treated properly or managed properly. Children with ADHD may have trouble paying attention and controlling impulsive behaviors. They may act without thinking about what the result is, and most of the time it is basically they don't have the normal attention span. Say for instance, a child in the kindergarten has a normal attention span of 15 minutes. Like a child can attend to a teacher or to any particular program for 15 minutes. But these children may not be able to attend to the teacher even for a 1 or 2 minutes. They keep changing, or they are not able to focus, and they are also become hyperactive in the classroom. So if there is an ADHD child in the class, it becomes a real trouble for a teacher, and that is when the teacher tells the parent that your child is difficult to manage in the classroom, and then the parents really look into the matter and that's when this really is screened. And not that every child who is hyperactive or is little naughty or is more energetic is ADHD. So most of the parents, then if the child is little more active, then they say, oh, I don't know whether my child is ADHD, and then they come to the specialist for screening to do whether the child is ADHD. So basically the main thing that attention deficiency hyperactive disorder is different in children. The characteristics or the symptoms seen in children will be different, and when they grow it differs. Like it may appear as more extreme restlessness when you see in adults. So we all know that what we eat is what we are. So most of the time the ADHD treatments, as Holland Taylor has said, it has to start with diet therapy or giving the right diet, that is the diet that can reduce these symptoms. And there are a lot of research done on this, and Virashalingam Institute of Home Science is also doing a good research on the diet aspect and how to do the diet therapy for these kind of children, for the children who have ADHD. So diet therapy or the diet management has shown promising results across the globe in several researches. So it has to be now, the diet differs from state to state, from country to country. So how it is going to, how we can modify the diet for ADHD in Tamil Nadu is really a great work or a research work that has to be done. And I'm happy that the Avanashalam institution has taken up this as one of the research project for PhD, and is doing a very wonderful good job in that. And another thing that we need to know about ADHD is that basically the main problem is because of the dopamine release in the brain, and that is what makes it as a neurodevelopmental disorder. And that's why we need to see that all the food that the child has is actually helping the brain function rather than making the child lethargic. Of course, now it is a contradictory thinking that most of the time the children, when they have ADHD, they are very hyperactive, and when they have certain kind of food that makes them lethargic, that is not the diet therapy exactly that we are looking into. We want the child to have the right kind of food which can keep the child energetic, can keep the child active but not hyperactive, and so that the child is not able to survive positively or successfully in the society. But definitely the child with the diet should be able to become a successful person scholastically, socially acceptable, and as well as the child has a good self-esteem. Diet therapy, you should go for, basically if you're planning a diet for ADHD children, you should go for a high protein diet, like include beans, cheese, eggs, meat and nuts. These are good sources of protein. If you eat these kind of proteins in the morning and for after school snacks, they improve concentration and possibly make ADHD medications work longer. That is, even if the child is taking medications for ADHD, it will be nice to have a high protein rich diet. Also, more complex carbohydrates like These are the good carbohydrates. Load up with more of vegetables and some fruits, including oranges, pears, apples, etc. These type of the food can be even taken in the evening, and it will help you to go to sleep better. Also, more omega-3 fatty acids. You can find these in tuna, salmon, and mostly fish. Also walnuts and olives and canola oils, etc. So these there are some research showing that these omega-3 fatty acids helps in brain function. So this can be also included in the child's in the diet. And there is there is something called viarin. That is viarin is an omega compound called viarin. It's a part of ADHD management strategy. So this also of course this can be the sources mostly from the seafoods or the fish. So this can also be included in the child's diet. And if the child is vegetarian and want to stick on to vegan foods, then you can go for walnuts and you can go for olive oil, etc. So these are the major the food diet or in the meal that you have to include. So ADHD diet management is requires a lot of patience when a dietitian is preparing a diet for ADHD children, because a lot of things have to be eliminated and a lot of things have to be substituted. So let us now check upon what are the things that we have to really focus on. So if the child is under the medication or not on medication, it is highly essential that the child is having a high protein diet. A high protein diet is highly essential. So high protein, any source, it can be animal source or from the plant sources. So the child should be given a high protein diet. So for example, the sources are like the egg, milk, and pulses and legumes. And another thing that we have to really look into is that the child should have not simple carbohydrates but complex carbohydrates. So it is ideal to have fruits. It can be local fruit. It is always not essential that the child should have expensive foods like apple and pear, etc. You can go for the local guava, the local the mango and banana, etc., plantains, etc. So the child should adequately or should be taking fruits every day. Ensure that the child takes fruits in the morning as well as in the evening. And the third is the omega-3 fatty acid. It is very essential because omega-3 fatty acids has a major role in the brain function, and we need to ensure that the child's diet has got, and most of the sources are from the fish and seafoods. Also for the vegans and the vegetarians, they can consume walnuts or olive oil, also flax seeds. These have omega-3 fatty acids. So major thing that we have to look into when you're planning for diet for the children with ADHD is high protein, and they should have complex carbohydrates, as well as they should go for omega-3 fatty acids. Another thing that is very important is, as we look into what is to be added, we also have to give importance to what has to be eliminated or to be restricted. So mainly it is the simple carbohydrates, that is like the sugar, candy, the potato chips, the potato wafers, and all these things that is very readily available and children often love it. Also we have to restrict white flour, that is maida, white rice. So these are the things that we have to really eliminate. Also chocolate and food additives, food preservatives, all these should be avoided. So when we are treating or giving a therapy for ADHD, we should be very clear about one thing. See, the diet or whatever treatment, it should not make the child lethargic or should not put the child to make us less active or non-active. This is sometimes certain medication when the children are into, like when they are in ADHD, and some medications, they really make the child really inactive. So that is not our focus should be. Our focus should be that the child's hyperactivity should come down, but still the child should be active. So the diet therapy that we should plan, or whenever we are planning a diet for a child with ADHD, ensure that the child still remains active and energetic. So the food should be so that the child can get energy, appropriate energy for all the activities. And also it is essential that it should be the right food. It is the right food that the child takes. See, mostly when you go for a processed food, there are simple carbohydrates in that, simple sugars in that. It gives energy, but most of the time that causes hyperactive in them. So some studies have shown that if you are feeding the child more with processed food and simple carbohydrates, it can lead to attention deficiency. So these are the things. Mostly we should not misunderstand that the hyperactivity has to be reduced and to make the child inactive. No, sometimes the medications make that, but our diet therapy or the diet is the best way to keep the child active and also to bring down the hyperactivity. So the energy rich food should be given, but it should not be simple carbohydrates, but it should be more of complex carbohydrates. That is what we need to look into.